Welcome to the Candida Chronicles with our host, Michael Biamonte, certified clinical nutritionist. In this podcast, Michael will answer your questions and reveal the shocking truth that the cause of most chronic ailments is not what you've been told. The source is Candida, a yeast overgrowth which, when it becomes systemic, can cause all sorts of seemingly unrelated ailments such as chronic fatigue syndrome and even weight gain. For more information on how Michael can help you, please visit healthtruth.com. That's health-truth.com, or phone his office at 212-587-2330. And now, without further ado, Michael Biamonte.
And hello everyone, this is Michael Biamonte, clinical nutritionist, with another episode of the Candida Chronicles. And to reiterate, if you've seen or have received our newsletter of late, this month the Biamonte Center is celebrating its 30th year in practice. And for the majority of the time, we've been specializing in the treatment of candidiasis. So we do have, over those years, many interesting memories and some very interesting stories to be told. And a patient today reminded me of one of the most interesting incidents that I can recall when our office was located on 139 Fulton Street in Manhattan, which was about 3 blocks away from the World Trade Center. We had a patient coming to the office and they were bringing their urine and stool sample to be tested. This was in the days when we were doing the urine tests and the stool tests right in the office. And the patient had the urine and stool sample very carefully packaged, and it was in a small gift bag. I believe the gift bag said Tiffany on it. So some bloke, seeing this young woman carrying a Tiffany bag, came running up behind her and grabbed the bag out of her hand and ran down the block out of sight. And I tell you, he was probably in for some big surprise when he opened up that Tiffany bag and he found her stool and urine sample. That's most likely not at all what he was expecting to find, but then again, if you're gonna live a life of crime, you're gonna have to pay the dues. So there you go. Well, today's subject is going to be how Candida affects the brain. And this is an interesting topic because it affects the brain in many ways. There are different substances categorically, or different reactions categorically we can go through. The first one we're going to discuss is probably the least known, which is the effect on the brain regarding trace minerals. Candida increases the amount of copper in your tissues. The longer one has Candida over a period of time, the greater the chance that he develops an elevated level of copper, even to the point of having copper toxicity. It's very typical on a trace mineral examination. You will find a person's copper will be over 6 milligrams percent. A normal level of copper is thought to be about 2 to 2.5 milligrams percent. In parts per million, that would be 200 to 250 parts per million. But Candida sufferers very typically have their copper levels up at 5 T, I would say them even as high as 15 milligrams percent. Copper has a very interesting effect on the brain. Symptomatically, what copper tends to do is cause a very excitatory reaction in the brain. Copper seems to enhance histamine and glutamine and the neurotransmitters, which tend to be excitatory. One of the typical responses that you hear from people with high copper is they feel like their mind is racing, and they very typically can't sleep because they feel like their mind is wired. Not so much the body, but their mind is wired. This is something that exclusively you will tend to see in the person with elevated copper as far as that reaction goes. Candida also releases a host of mycotoxins, which are highly allergic, of course, and cause inflammatory reactions on the brain. But most likely, the most interesting effect that Candida has on the brain is in the release of aldehydes. Aldehydes, as you may know, are alcohols. There is a specific group of aldehydes which is released into the body by Candida. And the person with chronic Candida, who has a good volume of Candida, is constantly being exposed to aldehydes. It's as though they were literally an alcoholic. This is why they'll complain of feeling hungover at times. This is why they feel the brain fog and the fuzziness, etc. This is because they're constantly exposed to alcohol that their own intestinal tract is fermenting. These aldehydes raise the free radical levels in the body. So you get an interesting combination of things happening to the person with Candida, because you're not only having the free radicals elevate that are associated directly with the aldehydes, but you also have the aldehyde aftermath that so many alcoholics are very familiar with, where you can feel dehydrated, you feel depressed, you feel tired, apathetic, you feel headachy, in part from the dehydration and also from the free radical exposure. Chemical sensitivities are another aspect of how the Candida would affect your brain, because Candida itself could cause leaky gut syndrome, or it causes similar autoimmune reactions. The person will then become very sensitive to their chemicals in their environment, which also cause an inflammatory state that affects the brain. The confusing issue is, for the patient who's not really familiar with Candida, is what's causing what and how do you deal with it? Well, there are essentially two styles of treatments that you can derive from this. One is going to be where the person is going to seek to nullify their symptoms by trying to detoxify their system and trying to treat literally the problem symptomatically. Now, in a case like this, the person is apt to try to use vitamin B1, niacin, pantethine, vitamin B6, vitamin C, NAC, which is N-acetylcysteine. They'll use different forms of zinc, of GLA, lipoic acid, silymarin, and silymarin-like substances, all for their ability to try to detoxify aldehydes. The amino acid cysteine also could be used or substituted for the N-acetylcysteine. But the whole point is the person is trying to detoxify these alcohols, which is causing these issues. And sure enough, all of the nutrients I just quoted are helpful in detoxifying those alcohols. But it's not really getting to the root of the problem. Not at all. The correct path is to eliminate the Candida. When you eliminate the Candida, you shut down the whole game, and then there's no need to be chasing the Candida symptoms around using vitamins and different nutrients. I also neglected to include, to some degree, copper on that list, and also molybdenum and selenium are also important nutrients in helping to specifically detoxify and protect your system from the aldehydes that are released by Candida. But again, as I stated, that's a failed approach. Any Candida program which emphasizes taking nutritional supplements is a failed approach. It's a failed approach because nutritional supplements do not eliminate Candida, and in many cases, nutritional supplements make Candida worse. Those of you who've heard our other podcasts are well aware of this. One of probably the biggest mistakes that people make is treating their system with antifungals, probiotics, and nutritional supplements simultaneously. This is a mishmash which doesn't get anybody anywhere. After quite some time, the person will realize this is a failed approach and they go off again seeking some other approach. When you treat a person who has Candida, and this this problem I'm referring to now is pretty much exclusive to Candida. Treating one who has Candida with supplements runs the risk of either making the Candida worse or giving the person supplements which are going to act as antidotes, literally, to the antifungals they're taking. When you take supplements which are high in calcium, copper, iron, coenzyme Q10, and vitamin D, you run a very high risk of making the Candida worse by spreading it, because calcium, copper, coenzyme Q10, iron, and vitamin D feed Candida, and these are nutrients which are essential for Candida's metabolism, and they will spread the growth of Candida. Antioxidant supplements, like the ones I just mentioned here, that are trying to detoxify the aldehydes from Candida, will block the effect of most antifungals. Most antifungals work by either depriving the Candida of the nutrients I just mentioned, or by causing oxidative damage to the membrane of the Candida to kill it. When you take antioxidants simultaneously with antifungal medicines, drugs, or herbs, the antioxidant is going to protect the microbe from the medicine you're taking, and therefore act like an antidote, and therefore stop the killing effect. I first learned this from a Dr. Roberto Gonzalez, who practiced up in the Bronx when my office was on 83rd Street in Manhattan. Patients who I had who were seeing him would tell me that with his herbal parasite treatment, he warned the person against taking any antioxidants. You could not take antioxidants on his program. I had a talk with him a few times about this, and he enlightened me to the very simple fact that the majority of all antiparasitics, antifungals, whatnot, whether they're herbals or pharmaceuticals, work by causing oxidative stress to the membrane of the parasite or the yeast. So if you're taking antioxidants, you're protecting not only your cells, but the cells of the organisms you're trying to kill. I very quickly adopted this into my treatment, and it's been very successful. It's also been a very interesting point of qualifications in debugging where a treatment is going wrong. If I have a patient who is not getting the results I expect them to, we will sit the patient down and say, well, let's see here, let's see what you're doing. What else are you doing besides our treatment? And very often you'll find they're taking handfuls of all kinds of vitamins, and the very vitamins that they're taking are inhibiting the treatment from working. They're stopping the treatment from working. The downside of this, unfortunately, is that many of these vitamins help the person's mental facilities and will actually help them feel better. So from the brain standpoint or the mental standpoint, taking these antioxidants and these different supplements help the person cope with the Candida and will make them feel better, make them function mentally better, but unfortunately it nullifies the treatment. So when looking at this, we have to come up with a way of handling this so that we're not nullifying the treatment, but yet the person still can function a bit mentally and get some relief. One of the tried and true methods that we have found to increase brain or mental function while the person has Candida is very simple. It's a matter of keeping the bowels moving. And this is a point also that can go back on our list of why Candida treatments fail, which we've had several podcasts on that over the last few months. But bowel movements, less than once per day, definitely is a recipe for a failure in a Candida treatment or any kind of treatment which is addressing your intestinal flora or one's dysbiosis. The more your bowels move, the better the treatment will work. The ideal situation in the Biamonte treatment is that the person's bowels move 4 to 5 times a day. Many of you right now are gasping, saying, I've never done that, I can't imagine that would be possible. Well, yes, it is. We've had many patients say that that wasn't possible and they wouldn't be able to do it. But it is possible when you drink enough water, when you consume enough fiber, when you have enough digestive secretions particularly hydrochloric acid from the stomach, which stimulates your peristalsis. When you have adequate thyroid function, adrenal function, that stimulate peristalsis as well. When all of these factors and some others are in place, your bowels can move that often. Studies that have been done in Africa and amongst the primitive people, the tribal people, show that they have no chronic degenerative disease. A book called The Save Your Life Diet, which was published, I believe, in the 80s, was essentially a story about physicians who were writing in Lancet, which is the British medical journal. They went to Africa because they had heard that there was never a recorded case of colon cancer amongst any of the tribal people. And they found, sure enough, when they got there, there wasn't. There was no recorded cases of colon cancer. But they also found simultaneously that there were no recorded cases of diabetes or any other chronic ailments there. These people either lived relatively healthy with no chronic diseases, or they died young from injuries and accidents and whatnot, because there was no real medical treatments there that could intervene, particularly with heroic medicine to save the people, using antibiotics and whatnot. When they analyzed the diet of these people, they found that they were eating 24 grams of crude fiber per day, compared to 4 to 6 grams in America and in the UK. They found that their bacteria had the perfect balance, or I should say their stool had the perfect balance of bacteria, was virtually odorless and totally formed, as opposed to the very high levels of E. coli and other bacteria found in the Westerner's stool. So there were quite noticeable differences when they were comparing the tribal people to the British commoner and the citizen in the U.S. as far as their intake of fiber, water, and the composition of their stool. If the bowels move frequently, the levels of aldehydes produced in the intestinal tract will drop because you'll excrete them more frequently. Essentially, the more frequent your bowels move, the faster your entire system, from the colon to the liver to wherever, will detoxify itself. And mental clarity is more easily obtained in the patient whose bowels move frequently. Again, if you can get your bowels to move 4 to 5 times, and not diarrhea, but some semblance of a formed stool, those bowel movements will help significantly lower the toxicity in your colon, which gets absorbed into your bloodstream, which then causes the inflammation in your nervous system and the brain, which then causes the different problems that people have with mental acuity when they have candida. Many of the supplements that are out there that are being sold to heighten memory, cognitive ability, and whatnot are virtually useless in the case of the candida patient. They're fine for the non-candida patient. Using them for long periods of time definitely has been found to show to help mental function and circulation to the brain. Excuse me, but they have not been found to work on patients with candida, simply because the candida is more powerful than these supplements. These supplements are not able to outrun the candida in the effects the candida creates on the body. So these supplements are using them as more of a pipe dream that something positive is going to occur. The way to handle the situation, the way to increase your mental acuity and your mental facility, cognitive ability and whatnot when you have candida, is simply to get rid of the candida. Rather than treating it symptomatically with vitamins and whatnot, this is a waste of time and something that doesn't give you any long-lasting results. In the short term, increasing the bowel movements and increasing the fibers in your diet and using bentonite and various types of clay and charcoal and things of this nature, which are highly absorbent, will help because they can absorb the toxicity in the intestines and lower that toxicity so it has less effect on the brain. But over the long run, the simple way to handle this is to simply get rid of the candida. And if you're tuning in for the first time, or you're a newbie to the Biamonte method, you can simply go to the same page you're on right now, look through the podcast library at some of the earlier and the more basic podcasts on how we get rid of Candida, and you will be very surprised and very enlightened to find out that there is a very specific path that one travels to get rid of Candida. The average person who's suffering with Candida, who seeks self-help, ends up doing a mishmash program. They first end up going through the internet, looking at all these websites, looking at symptoms, comparing their symptoms to other people. They eventually self-diagnose themselves with Candida, and then they look to see what are the best supplements to take. And this can be a hobby, and the person could do this for tens and tens of years, because this treatment, these types of self-treatments, are never going to work. They never have worked, and they never will work. You will get people that appear on various websites and blogs who will say that they eliminated their Candida by taking X, Y, and Z. But the interesting thing is none of these people have any tests to verify that they had Candida in the first place, and number two, that the Candida was eliminated. They are acting and speaking simply based on their symptoms. There is no objective evidence in these cases. So when you read and you hear about bloggers saying that they have eliminated their Candida by taking these probiotics or this and that, the first question is, do they have proof that they actually had Candida? We're going to look at this from, this is the strict scientific Western model we're going to take, is first there is no proof they ever had Candida. If they present proof that they had Candida, then they must present proof that the Candida is now gone as a result of them taking these supplements. Then the next thing we would want to see is how long do they stay Candida free? Because that is where most people are going to bog. Most people who proclaim their Candida was eliminated by taking these popular internet products don't happen to be around 6 months later to talk to you when they have a relapse. And surely they will, because they're not eliminating the Candida in the correct manner, so they're bound to relapse. They're also bound to relapse because the probiotics they're taking are never going to get a fair chance of sticking to the gut as long as the Candida is there. We're going to do a blog on this. I'm sorry, not a blog. We're going to do a podcast on this next week, specifically all about probiotics. But I will tell you now that the basic data that you're going to come away with from the podcast next week is that probiotics are a complete waste of time and a complete waste of money to take while you have Candida. Probiotics have never rid anyone of Candida. This is impossible because probiotics cannot adhere to the intestinal lining while Candida or dysbiosis is still present. This is why people take probiotics, get very little response, or get bloating and gas from them, and that's about all that happens. The only way probiotics help a person with Candida is for the person to take the probiotic when his Candida is gone, and that will ensure that the Candida does not come back, since the probiotic is the natural mechanism that regulates Candida in the gut. When you take probiotics while you have Candida, it's possible that you can feel much worse. I've written an article or two about this, which is on my website. You could feel like your Candida is worse. You could have a lot of bloating and gas, which is a normal interreaction between Candida and probiotics. And if you have leaky gut syndrome, it will even heighten those symptoms. Now, leaky gut syndrome is an interesting thing to mention because this is another arguable case. People who claim they have leaky gut, the majority of them have never been tested for it. I would estimate that half the people who think they have leaky gut do not. I'm estimating that based on my own practice. Half of the people who come to my office as new patients and tell me that they've been treating leaky gut for 10 years and it's never gotten better and they don't know why, when I test those people, I find out they don't have leaky gut. So much of this goes back to testing. And it will be the smarter person who you read or communicate to on a website or a blog or such thing, or the smarter practitioner who will rely on testing and determining your condition, because the symptoms of Candida and leaky gut and Epstein-Barr virus and dysbiosis and et cetera, overlap so much that it is virtually impossible with any sound authority to determine if you have these conditions without having an objective test. But let's assume the person does have leaky gut, it's been verified by taking a test. The odds are when they take probiotics, it's going to worsen their mental acuity and make them feel their brain fog is even worse, because it's very common that people with leaky gut react allergically to probiotics. And this is why this is going to occur. The brain fog that people complain about when they have Candida, probably one of the most common symptoms, is a symptom that doesn't necessarily fully go away by addressing the Candida. It will typically improve quite a lot, but there is no guarantee that the brain fog will completely go away by solely addressing Candida. And the reason why is because when the person has had Candida, and I'm saying has had in the past tense, the Candida unfortunately depletes the body of so many nutrients that it is possible that they will still have brain fog after the Candida is gone due to this depletion. Now, for those of you who are patients of our center, how I would explain this to you is that when you do your monthly urine test, the specific test in your kit called the oxidative test, the one that turns red, this is the one that's measuring aldehydes or alcohols in your system and the free radicals that are associated to those aldehydes, which are not being detoxified by your body. There are two options we can take when viewing this test. One is that we can consider that these aldehydes are still being produced in mass quantity by your Candida. Or two, we can assume that you've been so nutritionally depleted by your Candida that even though your Candida levels are now normal, and let's say your body's producing a normal level of aldehydes, your system of detoxification of these aldehydes has now been disrupted because you've had the Candida for so long. So at this point, if we're addressing your case and you've completed phase 2 part B, you no longer have Candida, your probiotics are now dominant. You're entering phase 3, which is where we repair your hormone levels, detoxify your metals, rebalance all your nutrients, etc. We're going to want to take a good look at what the levels are of your nutrients which detoxify the aldehydes. This is the point in the treatment where the nutrients that I spoke of earlier, the B1, the cysteine, the NAC, the vitamin C, etc., all of the nutrients that are responsible for detoxifying aldehydes, this is the point in time. Phase 3 is the point in time where you would then take these nutrients and you would expect to get some type of permanent result or a change in your oxidative test. If your oxidative test hasn't really changed much and it's remained positive throughout phase 1 and 2, phase 3 is where we will see a change when we address the nutrients that are required for detoxifying aldehydes. Your body was most likely so depleted of these nutrients while the Candida treatment was ongoing that it wasn't really going to make a difference on the oxidative anyway. So for all of you guys who've had elevated oxidative tests who are now entering phase 3 or in phase 3, this is the point that needs to be looked at now, is what are the levels looking like of the nutrients in your body that detoxify the aldehydes. And often we will find a key antioxidant in the system that's missing, that's allowing those aldehydes to stay elevated and keeping that test red for you. Sometimes it's germanium and sometimes it's molybdenum when we're dealing with just one nutrient. We've seen this on occasion where the person's tissue levels of molybdenum and germanium, and also selenium, I will add, were very low, And it was just the introduction of one of those nutrients that they were low in that resolved the red test, and the test no longer was so red, it just went very light pink. In other cases, it could be the entire list that I rattled off earlier in the broadcast that were necessary to detoxify the aldehydes. So we don't know really until we test you, and that's I think the hallmark of everything in this condition is you don't know really anything until you're tested. Because when you're going by symptoms, this is extremely subjective, and this condition is so complicated and has so many other conditions that overlap to it. It is impossible to determine the person's case simply by symptoms. I can tell you personally, I've been treating Candida for close to 30 years, and I'm known as an expert internationally on treating Candida, and I treat Candida and this entire condition heavily based with testing. We test people for virtually everything you could imagine, not only Candida, parasites, dysbiosis, bacteria, leaky gut, organic acid testing, mineral testing, on and on and on and on. With all the cases and symptoms that I've heard and all the tests that I've seen to compare to, I can tell you that I still would not trust even myself in guessing at the person's condition. And this is simply because there are too many symptoms that overlap, too many conditions with symptoms that overlap. And it really makes it very difficult to come up with an educated guess on the status of anyone's condition where you're going to have any real guaranteed accuracy. 50-50 is about as good as you're going to do in guessing with someone's condition. You must be tested. If you're not tested, you're really you're doing yourself, or your health practitioner is doing yourself a tremendous disservice, because without testing, you don't know accurately which way to go. And this condition is complicated enough even with testing. So without testing, the complication makes it unmanageable. Now, again, in dealing with the mental facility of someone with Candida, the obvious things that you would do that would make it worse would be to eat carbohydrates and sugars, which will ferment into more aldehydes. The other situation, which is very grave with a Candida sufferer, is living in a moldy environment. There is an article on my website where we talk about moldy environments and mold remediation. And this is very important because when a person is living in a moldy environment, the amount of mycotoxins that they're exposed to is varied, and it's very heavy. And it can cause just such a drastic amount of symptoms that treating the person internally for their internal Candida condition, it may not be enough. A person who has Candida develops a sensitivity to molds and yeasts and funguses and whatnot. Their immune system becomes very sensitive to it, and they experience a lot of inflammation when having allergic reactions and being exposed to these indoor toxins, let's say. When you improve the person's internal Candida or their own internal dysbiosis, and you then again subject them to this moldy environment, they will withstand it a bit better initially, but they're still going to be much more sensitive to the environment than the person who doesn't have Candida in the first place. So it's very important, this is unfortunate, but it is very important that a person who lives in a building or a home where that we would classify as a sick building syndrome type of home, a home or a work environment that's loaded with mold, it's very important for that person's recovery to get out of that house or get out of that work environment and remain out of there for at least 3 months to allow their immune system to destimulate from this experience. Otherwise, their mental acuity and cognitive ability is just not going to improve. The ideal recipe for someone like this is to treat the Candida correctly, eliminate it correctly, and then be out of these environments for a minimum of 3 months to allow your immune system to destimulate. Anything short of this is just not going to lead to any kind of stable improvement in the person. And the person will notice that when they re-enter these moldy environments, their brain fog and their mental acuity, their memory, their cognitive ability, all these things very, very swiftly decline once again, because you're exposing them again to these toxic molds and these allergic substances, which all equal one thing, which is essentially inflammation. We touched on this a bit, I believe, on Tuesday's podcast. We discussed dysbiosis and dysbiosis leading to inflammation, and then how that affects you. Well, this probably would be the overall effect that we get mentally with the patient. The reason why the person has the cognitive problems they have, or the mental problems, so to speak, that they have, is because their condition is generating a large amount of inflammation. And this inflammation affects your brain and your nervous system, and it produces very undesirable effects. So we are going to stay open here today for questions. Anyone who has a question, you're free to email me right now at drb@health-truth.com. That's drb@health-truth.com. I'd be happy to answer your questions. We're gonna stay live here for the next 5 minutes or so and see if we have any email questions come in, because this is a very hot topic. And yes, we're having one come in right now. And the question is, Dr. Biamonte, I've tried vinpocetine to improve my mental facility, and I have had no result at all from taking the vinpocetine. I suspect I have Candida and they go on to list their symptoms. And yes, I would agree with you. Vinpocetine is a very good substance. Vinpocetine is definitely known to improve brain function. But trying to fight off the effects of Candida with vinpocetine would be somewhat like trying to stop an elephant with a water pistol. I don't really see the effectiveness there. There's not enough power coming from the vinpocetine to reduce free radical activity there, to break down the aldehydes and whatnot. One thing we didn't mention when we were discussing this topic earlier in the broadcast is the effects of nitric oxide on mental facility in patients with Candida. This is something you can never overlook or downplay, and it is one of the things which you can improve, which usually will not worsen the Candida, and it will give you some sense of improved mental facility. Now, nitric oxide, we all know, is a chemical that's produced in your body. It's for those people out there that are familiar with arginine and ornithine and citrulline. Arginine, ornithine, and citrulline are the amino acids in the body that naturally produce nitric oxide. And what nitric oxide does, essentially, is it has the ability to increase muscle mass and strength, but it also opens up your blood vessels. Nitric oxide is a key thing in treating stroke victims or victims with any type of mental damage or cardiovascular damage, because nitric oxide opens up your blood vessels. You've all heard of nitroglycerin and nitroglycerin patches being used by patients with cardiac disease. Well, this is because these patches help to open up the circulation. Viagra is key in opening up the circulation in the pelvic region. Viagra was discovered completely by accident, in a sense. Viagra originally was to be used as a drug for people with mild to moderate hypertension and some angina pains. It's a drug which blocks the breakdown of nitric oxide. So when you take Viagra, the Viagra is blocking your body's natural breakdown of nitric oxide. It's letting the nitric oxide accumulate so that the nitric oxide can then open up the blood vessels. Well, it was accidentally found that the Viagra had a special action of working in the pelvic region. And after that, we all know what happened. It's quite a famous medication after that point. Nitric oxide's effect on the blood vessels in the brain are very significant because, like any other area of the body, the brain requires proper blood circulation in order to function. And when one increases the nitric oxide level in the body, you increase the blood flow to the brain, which increases clarity and everything in mental function. So this is an overlooked point from before. We'd put this on our list of things which would also help mental function, which is increasing nitric oxide. And it can be done in ways where you do not at all injure or suppress your Candida program from working. The supplements or even some of the medications that are used to increase nitric oxide don't necessarily interfere with Candida. There is a cream called Nitrobid cream, which one can get and put on the skin. It absorbs slowly in your skin. It opens up your blood vessels. It won't aggravate Candida. In fact, it will actually help you get rid of Candida even faster. And this Nitrobid cream will help your mental facility. It will not aggravate Candida. Taking the amino acids, arginine and citrulline, and ornithine with some other supplements which may be cofactors to raise nitric oxide also will generally not aggravate Candida or dysbiosis. And again, that will naturally help raise your nitric oxide levels. So those are items that you can definitely do safely without making your condition worse, which is always a good thing. All right, ladies and gentlemen, I think that's going to bring us to the end of this podcast today. Tune in next Tuesday for the next edition of the Candida Chronicles. And until then, I wish you health.
That's a wrap for this episode of the Candida Chronicles featuring Michael Biamonte, certified clinical nutritionist. Michael holds a doctorate of naturopathy and is a New York State certified clinical nutritionist. He is a professional member of the International and American Association of Clinical Nutritionists and of the American College of Nutrition, and he's a member of the Scientific Advisory Board for the Clinical Nutrition Certification Board. For more information on how Michael can help you, please visit healthtruth.com. That's health-truth.com, or phone his office at 212-587-2330.